We're now towards the end of the 21-day lockdown. Over the next 15 minutes, I'll take you through on the Corona India dashboard powered by the India Today Data Intelligence Unit, the latest metrics that we're getting from across the globe and from every state and every city in India. And to help us make sense of how we're doing, because what we can do as journalists is bring out the data and distill it and put it out on the screen. What we need to do then is go across to one of the world's leading public health experts to try and make sense of what this data is telling us relative to how India is doing vis-a-vis other countries of the globe. And for that purpose, I'm delighted to be joined once again by Dr. Ashish Jha, Director of the Harvard Health Institute. Thank you so much, sir, for taking out time for us once again. So let's start with the daily new cases. This is the latest metric. What you're seeing is these are the states in which maximum number of cases are coming out every single day. Here on the left side of the screen is the date that we're referring to, and you see which state is throwing up the maximum number of cases. Initially, a lot of cases were coming in from states like Delhi, from states like Kerala, but over the last several days, the maximum number of cases have been coming in from Maharashtra. So at this moment, the number of cases of the coronavirus in Maharashtra are actually higher than anywhere else, virtually double that of Tamil Nadu, Rajasthan and Delhi. Then you've got Gujarat, Andhra Pradesh and Jammu and Kashmir next in line. So Maharashtra is #1 impacted state, and even there it's Mumbai that is taken the prime hit. So that's as far as the number of new cases go. This is the trajectory tracker, which is now on your screen. We're looking here at the number of deaths. So when you look at the number of deaths, in China the number of deaths is stable. Now for the last several days it's been stable. The red graph is the Chinese graph, the one that I just clicked. This is China. The number of deaths now very, very stable. Let's just try and come in closer so people can see these lines. In India, you've got the curve in a very important position, because if you look at one particular state, you can say that the curve is bending, but if you look at the curve of deaths, it's still not coming down. But remember, this is just the number of deaths. Whereas if you see the United States, now a lot of what's being said by the president and his health experts is the number of deaths is beginning to plateau. So Italy has now clearly seen the worst, because here you can see the curve relatively flat. So they've now got the situation under control. So my first question to Dr. Ashish Jha, just on the basis of what we're seeing in a global context, Dr. Jha, what's your sense of where India is poised in the battle against COVID-19? How do you think the lockdown went? And that curve, which is not skyrocketing just at this moment, but isn't flattening either, what does it tell you?
Yeah, so thank you again for having me on. You know, it takes about 2 weeks after people stop moving, after a lockdown, to really start seeing its effects, both in terms of cases, and then deaths come another week after that. So what I see when I look at the India data compared to the rest of the world is, as I have said before on this show, that India acted early. I think that's great. That's why the number of cases is still low. Of course, social distancing in India hasn't been perfect. We've seen large crowds still come together. We saw what happened with the migrant workers. And so you would expect that it would take a little bit longer and the effect would not be as strong in India as it might be in some other places. But again, the number of cases is still low, and I expect some more flattening of that curve in the next week or so. And then I expect deaths to continue rising for probably another few days after that. But then, of course, there are going to be important questions about what happens when the lockdown ends and people start moving around even more again. What happens then? And that's something we all have.
So we've spoken of what's happening in India as a whole vis-a-vis other countries of the world. Let's now try and dive into some of the Indian states and get Dr. Jha's understanding on this. Now remember, this dotted blue line is the line that your country would be on if number of cases was doubling every 2 days. This dotted red line is the line that our country would be on if the number of cases was doubling every 5 days. So what we have over here are the different states. Now the good thing is that Tamil Nadu, which was on a 2-day curve, now especially because of the Tablighi Jamaat. Now things have relatively calmed down in Tamil Nadu, but it's still less than the 5-day curve, which means it's between 2 and 5 days, roughly around 3 days, that the number of cases in Tamil Nadu are doubling. That's also been the case in Delhi. So there's a huge spike, but then after that, it's kind of relatively calm, not completely under control, but not as bad as it could be. And Kerala, of course, is the one outlier where they've really been able to flatten the curve. The light green is Kerala, and this is the one state where you can see, even though they had a big uptick right at the beginning, they've now been able to bring the number of cases under control. The other state which is seen the biggest and the longest line over here is Maharashtra, the deep saffron state, where you've got the curve extending the furthest. But from what this seems, Dr. Jha, and I want your understanding of it, in none of our states at this moment, and knock wood for that, is the situation spiraling out of control. Yes, we've got some pockets of concern in Tamil Nadu, in Delhi, in Maharashtra, but touch wood, net, it's not got out of hand yet.
I think that's right. And again, this is the benefit of the national lockdown. That is, we're seeing the benefit of that. We know that it has dramatically reduced how much activity there is. Of course, everybody's feeling the cost of that lockdown in terms of economic loss. But what it has meant, it is that kept the virus from spiraling out of control anywhere, including even Maharashtra, which, as you said, has so many cases. So I think this is the benefit of that lockdown. If we keep the lockdown going, we will continue to see it rise at a much slower pace. And then, of course, the only caveat to this, Rahul, that's worth understanding is that, and I've said this before, testing is still not as robust as it needs to be. And so, of course, that means there may be other cases we're not seeing, other outbreaks and hotspots we are not seeing. That all said, the data to me says the lockdown is working. It really has slowed things down, and that's very good news.
Show our viewers data compiled by the University of Oxford, researchers at the University of Oxford, which looks at the stringency of the lockdowns. India apparently has the strictest lockdown in the world. Along with South Africa and New Zealand, India has 100, which is the maximum you can get on the stringency index. Remember, a stringent lockdown isn't necessarily a good thing. It just means that of all countries in the world, we have the most stringent conditions for lockdown. Next comes Italy at 95. Then you've got Spain at 90.5, you've got Germany at 80.1, in a country like the United States about 66.7. Now, what's your sense? The stringency of the lockdown for a country like India, and you trace your origins back to our country, is that a good thing? Because a lot of people would say, Dande ke dam pe hota hai yahan pe, if you let people roam around, then they'll run havoc. So it's good to lock people up because that truly is the only thing to do.
Yeah, no, look, lockdown, so India, first of all, I think the Oxford metrics, India has done a very good job. It's been a very aggressive lockdown. You can have the policy, of course, not everybody is compliant, but most people are, and I think that's really made an important difference. And we can see it in the data. We can see it in the fact that the cases have not skyrocketed. Of course, the question is, how long can we sustain this? And we also know that the cost of the lockdown is so massive, especially for the poor.
You think should be done? Now, that's the point that I want to ask you towards the end.
Yeah.
Here is, how the moving average of the number of new cases being reported every day. We were earlier growing at about 20%. That's now come after the lockdown down to 17%. How do you think we should approach the post lockdown 1.0 situation? What would you like to see the Indian Prime Minister say when he speaks to the nation and explains what lockdown 2.0 would look like? If you were drafting the strategy, what would you recommend, sir?
Yeah. So the first thing I would say is that we're not going back to normal. So the normal activities cannot continue. There are certain things that we cannot do. Mass gatherings would be a disaster, and there can be no mass gatherings for a while. So then we slowly go back to economic activity. We unlock. But, the key to staying open and staying unlocked is having a very vigorous testing infrastructure. So if I was advising the Prime Minister, I would say, communicate to people that life is not going to be normal anytime soon. Even when we get rid of the lockdown, we will have to act differently, still have to have some social distancing. But the other thing is that people have to know that we're going to ramp up testing very substantially. People are going to have to get tested and isolated. And that is how you keep the country open and moving forward. Otherwise, the country is going to have to lock down again. And that's what we want to try to avoid.
I was seeing that press conference in Washington where Donald Trump was reacting to some of the comments that you made. So that was interesting, and really appreciate you joining us with your thoughts on how you see the situation in India. Dr. Ashish Jha, Director of the Harvard Health Institute, for joining us on this broadcast. Thank you, sir. Thank you, and I hope that over the next few hours, you can virtually, as part of an extension of our medical cabinet, come back for more of your insights. We really appreciate this. Thank you, Dr. Jha.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.